My inspiration for focusing on access to safe abortion care really relates to some of my earliest experiences in medicine. I became really drawn to this intersection of clinical medicine, public health, and public policy because I really saw how it was important to address all of these things to make a real difference in people's lives. My name is Daniel Grossman, and I'm a professor in the Department of Obstetrics, Gynecology, and Reproductive Sciences. I provide clinical care at Zuckerberg San Francisco General Hospital, and I also direct a research program in the OBGYN department called ANSWER, Advancing New Standards in Reproductive Health. While I have two roles, they're really very interconnected. The research that I do and that my colleagues at ANSWER do is very relevant to clinical practice in influencing policy related to that practice. And my public service work has largely focused on advocacy related to abortion care. And then I've played a role in several court cases. We had been collecting data about the impact of a law in Texas known as House Bill 2 or HB 2 and showed how it led to the closure of clinics and forcing abortion out of reach for some patients. And because we had been working there with clinics for years, I was asked to be an expert witness in this case, and eventually the Supreme Court ruled that two provisions of the law were unconstitutional. The research that we're doing will end up changing practice, changing policy, and making a difference for people. I see this access to safe abortion care is certainly an issue of public health, and this is also an issue of basic human rights. And these are really the reasons that motivate me in my work. UCSF has a really important role to play, and I'm really thrilled to be at an institution that is brave in this area and stands up and will be that loud, evidence-based voice.